Okay, last time I made a video that people with blocked tubes or blocked tube, they can conceive naturally without surgery or IVF. So in this video, we're going to teach you or tell you the things you are supposed to do and you will conceive naturally if you have blocked tubes. In case you're seeing me for the first time, welcome. My name is Ifechukwu Prudensiana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. I film health-related content. If this is the type of content that you're interested in, keep watching. Remember that whenever a woman has blocked tube or blocked tubes, the first thing you need to find out is what caused it. Find out the cause of the blockage. That is the first treatment. It's not about, hey, go for IVF, go for surgery. No. Find out what caused the blockage. That is the first treatment. And remember that almost all the causes of blockage is as a result of infection. The most common cause of blockage of the tubes is infection. Pelvic inflammatory disease, especially STI, sexually transmitted infections. We have two of them, gonorrhea and chlamydia. They are the two most common causes of blockage of the tubes. So one thing you will do is to now treat the infection. That is the second thing. When you must have known the cause, treat the infection. Let me say more than 80% of blocked fallopian tubes are as a result of infection. Yes. The few will now fall under previous ectopic pregnancy, previous abdominal surgeries or pelvic investigations, and then infection is the most common cause of blockage of the tubes. So treat the infection and you will be fine. Gonorrhea and chlamydia, they are the most very serious thing. Chlamydia and gonorrhea. Treat the infection. I have somebody, or rather, I know someone, not even one, not even two. I know people who presented with blockage of the tubes. The doctor said that he was not going to do anything surgically with them until they go and treat the infection. Because even if they decide to go for IVF, that they are likely to have failed IVF, because that infection, it will reduce the success rate of the IVF. And if you ever take them into the theater for any procedure, that the infection will end up spreading all over the body, worsening the whole thing. So the first thing to do is to treat the infection and you will be fine. Just treat the infection. You will be fine. Now, in the treatment of the infection, it's not only you. Don't treat only yourself. Treat alongside with your partner. Your wife or your husband. Treat alongside with your partner. Very, very important. Treat alongside with your partner. Otherwise, your treatment will not be effective. The third thing you need to do is, you see those underwears? You as a man, you as a woman, please gather all of them, burn them, discard it. and get new ones. And when you be washing your underwears, it's not something you will wash when you are taking your bath. Like you use the water, check, you spread it inside the bathroom. No. Don't wash it when you are taking your bath. Have a separate pocket for it. Soak it with jig. If you cannot spread it outside for sunlight, please use electric iron to iron it very well. To iron it very well, use something like the towel. After washing, use the towel to rinse your undies. Everything about your undies, discard it, get fresh one as a man and as a woman. Because you cannot be on treatment and you are still using those things you are using. Those things are a kind of contaminated. You understand? So you need to get a fresh something. You're just starting afresh. You're just rebranding yourself. So things need to be clean and new. So iron them. If you cannot spread them outside, please iron them. Very, very important. Iron them. Now, the fourth thing you need to do is food. There are foods that are very, very important that help in blockage of tubes. They reduce inflammation, thereby helping to open the tubes. So it's not about rushing for IVF. Get yourself together. Then, if it didn't work, you now talk about what step to take. Whether you will now go for surgery or IVF. If you go for IVF with infection, is most likely going to fail. Yeah. That is why some people have failed IVF. They will try once, 2, 3, it will fail. You need to put yourself together. IVF is not just a small thing. You can just go in, do it, and go. No. Things need to be in order before you go for IVF. Then the food you need to be eating, vitamin C, very important, is antioxidant. Vitamin C is rich in antioxidant that will help to treat blocked tubes. We have ginger, garlic, turmeric, and cinnamon. Very important. They help with inflammation. They help with scars, thereby helping to prevent blockage. Then the next thing you need to be eating is that you need to place yourself on fruits and vegetables. Yes, very important. Avoid alcohol, avoid smoking. Reduce the rate at which you expose yourself to stress. Reduce your stress, manage it very well. Stress is inevitable, yes, so manage it very well. Then, the last but not the least is have one sexual partner. Very important. Otherwise, you will end up reinfecting yourself and causing more problem to yourself. I hope this helps. If you have any question, ask me in the comment section. I'll be right there to answer you. Until I see you again in my next video, please do take care of yourself and drink plenty of water.